Hello guys, quick video to see this case, a comparison between OPG, periapical radiograph, and the CBCT of a radiolucent lesion. So the lesion is small, I hope you guys are already seeing on the screen and locating the lesion. The lesion is small, round, symmetric, with corticated borders. It's a radiolucent lesion located at the middle third of the roots of some teeth at the posterior mandible. So where is the lesion? So of course, this is the lesion, okay, between the first lower molar and second premolar, and we have the lesion there in the middle third of this root. We are also seeing a hypodense or radiolucent image suggestive of caries. So we have interproximal caries as well, even mesial caries of the molar, but since OPG doesn't give you details, most likely you would prefer to order a periapical radiograph to see more details, and that's perfectly fine, right? But then to plan the surgery of this lesion, then even a CBCT is better because you need to understand if this lesion is on the buccal side or the lingual side. So let's see, that's the OPG of course, and that's the PA, that it's a little bit better. So the lesion is closer to the second premolar as opposed to the first molar, superimposed to the lamina dura of the second premolar. All right, so to plan the surgical removal of this lesion, then you need a CBCT. We took a CBCT and let's see now the findings of the CBCT. So we are seeing here this slice, and of course it's just a single slice of each plane, sagittal, coronal, and axial planes, and you are seeing the mental foramen and a hyperdense area. So you are seeing something else now. And the hyperdense area is partially well limited. It's actually well limited. The patient has more than one. You are seeing two hyperdense areas here. Hyperdense means radiopaque, of course, and they are suggestive of idiopathic sclerosis, right? So idiopathic sclerosis on the screen. All right, and then we have even an image suggestive of caries. So we have the image suggestive of caries here, all right, between the two molars. But okay, and then let's see the lesion. So the lesion is suggestive of lateral periodontal cyst. Of course, that's the differential diagnosis of the lesion, and it's closer to the buccal plate, which is good to access this lesion after opening a flap. Okay, if you guys don't remember how to open a flap and how to deal with a lesion like this, and even how to perform epicoectomy, those videos will be available for you guys. The link will be added to the top right corner of this screen. It will show up at some point. But there you have it. It's between the roots of the premolar and the molar, but also causing a little bit of buccal plate fenestration, which is a good prognosis for you to do the surgical excision of this lesion. Hope you guys liked. See you guys very soon.